We're here at the Web 2.0 Summit with Rebecca Woodcock. She is the founder of Cake Health, which TechCrunch described as the mint for health insurance. Mm-hmm. Do you buy that description?
I like that description, yeah. Okay. It's not a bad company to be associated with.
Well, it relies upon us knowing what mint.com does, though, of course.
That's true.
So what does Cake Health do?
So Cake Health is a website that will help you keep track of your health insurance and your medical expenses. So as a user, when you come to our site, all you would need to do is tell us your health insurance company and give us the login information for their website. We can log into your account, and our technology will pull in your plan and your claims-related information and just give you insights that you wouldn't have on what your out-of-pocket spending looks like, where you are meeting deductibles, how your plan changes once it does, and we'll show you at any given time what your coverage is. We can also make recommendations as to are there benefits that you're not currently using that you could be, or if there's a plan that might be a better fit for you based on your actual costs and usage. So that's where we get that mint correlation.
Got it. Well, it sounds like helping people make better data-driven decisions.
Yes.
And so then the natural question is, where does the data come from?
The data comes from the insurance websites currently. We have access, users grant us access to their accounts, and so that's where we get all the information. As soon as the insurance can update their website, we can update our website.
And in terms of the business side, where does the revenue come from?
So initially we are looking at doing some referral, new plan matching, and that would be a referral fee for us. We're also going to be adding transactions, so facilitating the payment of outstanding bills if there is something that you still need to pay. We also will, and around that, we'll be adding alerts and verifying what it is that you actually do owe. There's a lot of errors around this, so we can verify that. And then we're also moving into some different partnerships as well, and I don't want to speak too much on that, but there will be some additional revenue there.
Great. And in terms of expanding or further rolling out the service, more data is usually helpful. Some of the data will come from the private sector, from insurance companies, as you mentioned. Some might come from the public sector. To what extent are you using open public health data?
We are currently pulling in some public information about codes and correct, incorrect coding combinations that we can dashboard against. We're also, I know there's more transparency coming out very soon around cost versus quality, which we plan to tap into. There's also more claims-related data that will be published very soon. So we have a very good relationship with HHS and the government, and they keep us in the loop on what data is on the radar and coming out in the future so that we can start using it when they publish it.
How important has that been to your business?
Well, so far in our version 1 of our product, we haven't needed it, but with some of the features that we want to build in the future, it'll be pretty important to us. And especially in the spirit of transparency, that data will be very important for us.
As you look towards that future, what are some of the biggest challenges for working with the companies that are involved, and particularly with people who need better information to get to better health outcomes? Is it a matter of awareness? Is it a matter of being concerned about the security and privacy stuff, which is legion with health data? Is it a matter of usability? Is it all three or something else?
Well, in my opinion, the step 1, the biggest challenge, is getting people to understand the decisions that they need to make. And so far up until this year, especially around healthcare, the decision has been made by someone else, whether it's from the HR department, your doctor. So this is all changing, and this is part of this consumer-driven healthcare that people are talking about. the decision to even select a plan or where your costs are going to, or how you're spending your money is being pushed down to the individual. What services are you going to be getting? That's being pushed down to the individual. The problem is that most people have never had to make these decisions before. They don't have the proper information, and they don't know how to curate or decipher all of this. So there will be a need for more tools to help make it very simple. It's so complex, and that's one reason why Cake Health fits into this category right now, is we're helping to streamline some of that and make it very simple for people to understand. I think that's step one.
Okay, so last question. Is there an app for that, so to speak, right? I've got a tablet here, the Android tablets are maybe on the scene. Certainly got the whole universe of smartphones out there. Have you? What's your approach to mobile? What did you start developing on? Because I'm assuming you're doing things.
Yes.
And how is that going to relate to your actual business strategy?
So for health, it's very important to become mobile very quickly. You know, Cake Health is a website. It's not like a news or media site where you can go every single day and get updates on something new.
Yeah.
You probably won't do that. But we can push information and when it's necessary, or if there's a decision that needs to be made, and we can remind you and prompt that. Mobile's going to be very important for that strategy. We've already developed an iPhone app so that you can at least reference your plan and coverage when you need to, if you're out and about in the doctor's office perhaps. And where we see that going for us at Cake Health, we think that even in the doctor's office, when you're there and you're being referred to another service, where we see this going is you can get pre-approvals for that service, you can see what's covered, what your responsibilities, and actually make more of an active decision in the doctor's office and know how that's going to impact your wallet beforehand. We also are developing some interesting technology around reading the bills once you actually get your paper bills or the non-bills, those EOBs that look like a bill. And some people can't tell the difference. And so we'll be able to tell you and give you some feedback in real time. What does this mean for you, and what do you need to do about it?
Okay.
So those are some things that we're working on in the immediate future.
We'll keep an eye out for the app.
Yeah.
All right, Rebecca, thanks so much for the chat.
Thank you.